It's good to know common side effects for any medication that you're giving. So for the opioids, post-op nausea, vomiting is a big one. It's one of the main risk factors for post-op nausea, vomiting, actually. They can pretty reliably cause ileus or constipation, and this is almost, you could say this is an effect and not really a side effect, because loperamide, which is an opioid agonist, is used specifically to cause this in people with diarrhea. They cause apnea and respiratory depression, which we already talked about, but just to reinforce the fact that this indeed can cause death. So have to be cautious about their use. Technically speaking, they can also cause skeletal muscle rigidity. Skeletal muscle rigidity. But this is only at high doses. So if you're redosing someone with opioids for analgesic purposes in PACU, this is not going to happen. If you see muscle rigidity from an opioid, it will be on induction where you're using high or even higher than normal doses. And how this would manifest would be sort of a restrictive lung pattern or restrictive ventilation pattern where you need high pressures to deliver any kind of meaningful volumes. But of course, your differential for that includes a lot of other things that can happen at the time of induction, like bronchospasm or laryngospasm. But this should be on your list of possible things, I suppose, if you give a high dose. They can cause sphincter spasm, so sphincter of Oddi. So if you have someone with abdominal pain as a result of sphincter of Oddi spasm, maybe that will even get worse when you give an opioid. And then it also causes urethral sphincter tone to increase. And this is perhaps more clinically relevant to us in the perioperative period because this can be associated with urinary retention. And this could mean that someone needs a Foley catheter when they otherwise wouldn't, etc. They pretty reliably cause pruritus or itching. And for some of them, this is the result of histamine release. So morphine releases histamine, but you get pruritus with other opioids too, even that don't cause histamine release. So this is independent of histamine, and therefore you cannot always block the itching of opioids by giving someone an antihistamine like Benadryl. I suppose we should say that there is addictive and abuse potential for opioids as well. Although this is by no means a reason to restrict opioid use in the perioperative period. That would be cruel. Maybe just paying respect to the fact that this can happen, but it doesn't mean that you will not give someone opioids by any means.